Hello, so today our project will be about the Carbapenemase resistant Klebsiella pneumoniae, and this is by the following members that are listed below.
In this video, we will review the causative agent, history, epidemiology, pathology, response and treatment, and socio-politico-economic considerations.
Today we'll start off talking about this with the causative agent. So this is caused by the Klebsiella pneumoniae, and that is a non-motile opportunist pathogen. This bacteria stains pink, making it gram-negative. It is a bacillus because of its rod shape, and the bacteria possesses a capsule. Some metabolic structures are the beta-lactamase production, efflux pump, plasmids that carry genes for antibiotic resistance, and its ability to form biofilms. This image right here, this was taken by the Getty Images, and this is just sort of a visual representation of what these might look like.
CRKP was originally reported in the United States during the late 1990s. Since then, it has rapidly spread across countries and continents, such as Canada, the UK, Spain, and France, and India. KP is one of the most relevant opportunistic pathogens that causes infections such as pneumonia, wound infection, intra-abdominal, and urinary tract infection. In recent years, KP has developed resistance to these antibiotics. The overuse or misuse of these antibiotics have contributed to CRKP. A study in the United States showed that CRKP strands were mainly derived from urine. However, in pollen, CRKP strands were mainly derived from urine and feces. An Italian showed that CRKP was mainly caused by urinary tract infection.
CRKP has emerged as a significant global health threat, with its prevalence varying by region. The bacterium contributes to high morbidity and mortality rates among infected patients. The Centers for Disease Control and Prevention classifies CRKP as an urgent threat. The prevalence has increased significantly since the early 2000s, with outbreaks reported in hospitals and long-term care facilities across the country. There is high prevalence in Southern and Eastern Europe. Countries like Italy, Greece, and Romania have experienced significant outbreaks. CRKP is highly prevalent in countries such as China and India as well. CRKP is commonly found in intensive care units, surgical wards, and other high-risk areas. Several factors increase the risk of CRKP infection, including using catheters and ventilators that can harbor CRKP if not properly sterilized, and extended hospital stays. CRKP spreads through person-to-person transmission, contact with contaminated surfaces, medical equipment, or shared items, and through environmental reservoirs, including plumbing systems, sinks, and other water sources. CRKP infection, particularly bloodstream infections, have mortality rates as high as 50%. The epidemiology of CRKP highlights the critical need for coordinated efforts in infection control and antibiotic use to mitigate its impact and further prevent spread. The global nature of CRKP highlights the importance of international cooperation and continuous research to develop new options and improve existing control strategies.
So here are the certain systems within the human body that are greatly affected by the infection Klebsiella pneumoniae. I'll highlight one in particular, which would be wound site or skin and soft tissue damage. So if the infection Klebsiella pneumoniae passes through an open patch of skin, which could be a cut or a bruise, it can cause a lot of tissue damage. Also, it can lead to septic or septic shock, leading up to necrosis, which is tissue death. Some of the toxins produced by Klebsiella pneumoniae are listed here. I'll highlight two in particular, which would be capsule and colonic acid. When Klebsiella pneumoniae passes through the body, it is engulfed in a biofilm called a capsule. Within that capsule is colonic acid. Colonic acid's role within this is that it releases the acid to help assist with penetrating the human body and invading the immune system. This can cause the infection to bypass macrophages and avoid death from neutrophils. An important point to highlight within the time sequence would be the illness and the symptoms. So there is a main list of symptoms that many people have reported having, but also the symptoms depend on the location of where the infection is. So for instance, the lungs. In the lungs, it can cause a lot of respiratory distress, being coughing, wheezing, a lot of mucus and production, and also some bronchiolitis. Versus within the urinary tract, it can produce a urinary tract infection, which could include fever, chills, painful urination, bloating, and ultimately it can lead to confusion and hospitalization if not treated properly. And that's mainly seen within the adult geriatric population. Some of the infections that coexist with Klebsiella pneumoniae are included here. Like I stated before, pneumonia and urinary tract infection are very big within Klebsiella pneumoniae. And again, some of the signs and symptoms just vary depending on where the infection has been penetrated. So again, for the lungs, again, it could be a lot of respiratory distress. And for another thing like meningitis, it can cause stiff neck, fever, light sensitivity. It can cause a lot of headaches and a lot of fever spikes as well.
Response and treatment of CRKP. Many immune cells such as monocytes, inflammatory macrophages, and dendritic cells work together to combat this infection. The immune system's adaptive immunity also activates neutrophils, T cells, and natural killer cells to the site of infection to fight it. Although CRKP is carbapenem resistant, some antibiotics have been shown to help cases of this infection, such as colistin, tigecycline, and fosfomycin. Proper sterilization techniques of all medical equipment used on patients with CRKP, contact precautions such as wearing personal protective equipment, and proper hand hygiene can limit the risk of this infection since it is so prevalent in hospitals.
A proactive study done by the National Library of Medicine noted that from 2016 to 2020, 509 patients from all ethnicities were diagnosed with an infection from carbapenem-resistant Klebsiella pneumonia. A rise in cases has been noted since 2021, and a notable number of patients came from long-term care facilities. This rise creates social strain by creating anxiety within communities around healthcare, along with social strains of trying to prevent the spread of the bacteria. Increased awareness about how antibiotic abuse can lead to drug resistance can help prevent future mutations. Economically, the increased healthcare costs for patients and healthcare companies can create strain, and the indirect cost to patients who are not able to work due to infection of the bacteria and their families who may need to support them can also create strain. Politically, growing concern over healthcare costs, availability, and education can create strains for politicians and voters alike who are responsible for redistricting, running campaigns, and zoning, as this can create tension when trying to choose a new candidate, or simply when trying to choose which communities are being prioritized for more access to healthcare or updated healthcare. The following slides contain the resources used to create this video.
Thank you for watching, and we hope that you found it helpful.